Anterior segment dysgenesis, it is an inherited group of syndrome associated with abnormalities in the anterior segment development, that is all the structures lying in front of the anterior vitreous face. The main pathophysiology here is the defective development of the neural crest. We can see here the neural crest cells. These are the green ones are the neural crest cells. Defective development of the neural crest cells is the main pathogenesis here. There is no gender predilection and usually it starts mostly during childhood and involves both the eyes. Now the main genes associated with mutation in the IRID1 gene on chromosome number 6. It is also associated with other genes like PITX2, FOXC1, FOXC3, PAX6 and CYP1B1 genes. The syndromes associated with anterior segment dysgenesis are Alagille syndrome, Axenfeld-Rieger syndrome, Peters anomaly and iridocytosis. Iridocytosis is nothing but splitting of the iris. Then coming to the first one, first we will discuss about Alagille syndrome. Alagille syndrome, the main gene associated here is JAG1 gene. Here there is posterior embryotoxin, here the main feature here is posterior embryotoxin. See in angle, the structures of angle is ciliary body, scleral spur, trabecular meshwork and Schwalbe's line. This is a Schwalbe's line here. It is a peripheral termination of the descendants membrane. Now in posterior embryotoxin means there is anterior displacement of this Schwalbe's line. Here this is the anterior displacement of the Schwalbe's line. Here again in gonioscopy this is a Schwalbe's line. Anterior displacement of the Schwalbe's line is known as posterior embryotoxin. Another picture here. This is a posterior embryotoxin, this picture here. This is arrow. The anterior displacement of Schwalbe's line with premature termination of descendants membrane, that is the posterior embryotoxin. In Alagille syndrome, it is associated with posterior embryotoxin and other fundus changes like pigmentary retinopathy, then optic dysgenesis, and there are other systemic abnormalities also in Alagille syndrome like absent deep tendon reflex, abnormal facial features, pulmonary valvular stenosis, peripheral arterial stenosis, etc. There is because of this the patient is having high risk of pulmonary embolism. Next is Axenfeld. Now there is Axenfeld anomaly. Now in Axenfeld anomaly, it is characterized by this posterior embryotoxin, that is the anteriorly displaced Schwalbe's line. Along with it there is iris strands here. See the iris strands are adherent to these anteriorly displaced Schwalbe's line in Axenfeld anomaly. Now if glaucoma, now that is Axenfeld anomaly. Now coming to Rieger's anomaly, then in Rieger anomaly, if there is Axenfeld, along with there is iris hypoplasia with holes, and like if it is associated with posterior embryotoxin, then there will be glaucoma also. So because of this iris hypoplasia with holes, this Rieger anomaly is associated with congenital iris anomalies like including this iris hypoplasia. Iris hypoplasia will be there, keratoconus and polychoria. If this is Rieger anomaly, if there is features along with this, if there is systemic involvement related to the neural crest maldevelopment, example maxillary hypoplasia and dental anomalies, maxillary hypoplasia, then it is known as Rieger syndrome. That is Rieger anomaly plus systemic abnormalities like Rieger syndrome is nothing but Rieger anomaly where there is iris along with posterior embryotoxin, there is iris change, iris abnormalities, then it is called Rieger anomaly. If along with the Rieger anomaly there is systemic abnormalities like dental, craniofacial, redundant periumbilical skin or skeletal changes, then it is called as Rieger syndrome. Now coming to next one, Peters anomaly, it is also known as anterior staphyloma. It is associated with it is either autosomal dominant or recessive. Sporadic is the most common sporadic most commonly, bilateral in 80% of the cases. Here it is associated with central corneal opacity with attachment of the iris to the cornea. Here we can see the central corneal opacities. It is also known as the internal ulcer of Hippel. Internal ulcer of von Hippel. If the central cornea is always opacified, then it is type 1. If there is lens opacification along with central cornea, then it is known as Peters type 2. This tends to be bilateral in 60% of the cases. Peters plus syndrome is when there is associated systemic abnormalities, like most commonly there is short disproportionate stature. Now the gene inheritance is sporadic mostly, as we said, sporadic mostly, and it is associated with if there is associated CYP1B1 gene, then it is usually autosomal recessive. Now this is the same gene as in congenital glaucoma, same gene implicated in congenital glaucoma, CYP1B1 gene. Now you know like, so this is just like in Alagille syndrome, there will be posterior embryotoxin will be there. Posterior embryotoxin will be there. Along with that, there will be pigmentary changes and optic disc drusen, and there is high risk of pulmonary embolism. Now Axenfeld-Rieger syndrome, see, if only posterior embryotoxin is there, then it is known as Axenfeld anomaly. If it is associated with glaucoma, this posterior embryotoxin leading to glaucoma, then it is known as Axenfeld-Rieger syndrome. Along with this, if there is congenital iris abnormalities, then it is known as Rieger's anomaly. That is either iris hypoplasia, correctopia. It is known as Rieger's anomaly when there is congenital iris abnormalities like iris hypoplasia, correctopia, polychoria. Rieger syndrome is when these involve the systemic also, like leading to neural crest maldevelopment will lead to systemic involvement like maxillary hypoplasia and dental anomalies. Now these are the DDs of congenital cloudy cornea. It can be remembered by the mnemonics termed S for sclerocornea, T for tears in Descemet's membrane like in birth trauma, then ulcers, metabolic disease, Peters anomaly. Edema can be due to congenital hereditary endothelial dystrophy, dermoid. Others include congenital stromal corneal dystrophy, rubella, posterior ulcer of von Hippel, posterior keratoconus, congenital corneal staphyloma, and congenital hereditary endothelial dystrophies.